Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? As promised, I'm bringing you amazing plastic surgeons from across the country. And today I'm so excited to have Dr. Christopher A. Park out of Alabama. And you guys are in for a treat because we have a really exciting conversation and I know you guys are going to love it. So thank you for being on the show, Dr. Park.
Thank you for having me. Been looking forward to it.
I'm super excited to have you on. You know, with my audience, I like to have conversations that sometimes they're not privy to, right? Like I was a coordinator and we had some interesting conversations in the office. And with my show, I want to give my listeners a behind the scenes kind of listen to what I hear, what conversations I've heard, and what makes me so passionate about plastic surgery. And I'm really excited to have you on so that you can tell us what is your passion in plastic surgery, what brought you to plastic surgery, and we'll go from there.
So I always knew that I wanted to be a surgeon of some sort. I really didn't know that much about plastic surgery. And like most of life, I think it comes down to mentors. And I ran across a gentleman, Louis Vasquez, who a lot of people know the name of. He's founded a lot of the basis of the surgeries that we do today. You know, plastic surgery really exploded in the 80s and 90s. I mean, in 1970, all we really knew how to do was sew things up and skin graft things. And 80s and 90s, we learned to master all these procedures that have made plastic surgery just so commonplace. But that's because we learned to do them well. And we learned to do them safely. But there was a whole group of leaders around that time, and he was one of them that just changed everything. And so I met him one day as a medical student, you only get one little summer break in med school, and that's after your first year of med school. And most people either work to make money or go relax or take a little break. But I actually spent the summer with him and just saw the fantasticness of plastic surgery, the variety of what we do. I love that it's a problem-solving society. If I did something else, I'd probably be some sort of an engineer, you know, if I went back and took a totally different non-medical path. And so plastic surgery is the specialty that allows me to apply that the problem-solving mentality. And I just love it. I mean, there's no limit to what we can do, and there's never a boring day.
Absolutely. So one of the things that I also like to do on the show is hear different opinions about different things. So I've told my girls, my listeners, that they should look for somebody who does that specific procedure that they're looking for often. And sometimes you can find somebody who all they do is mommy makeovers, or all they do is face, and all they do is liposuction, or all they do is BBLs. And when I was speaking with you right before we got started, you mentioned how that is something that you feel does some injustice to the surgeons like you, who are somebody who practices all of the different procedures. And I would love to hear your point on that.
Absolutely. I mean, you know, when I was looking around at other specialties, as I kind of mentioned, what I loved about plastic surgery is all the things we did. And I saw orthopedists, you know, 30 years ago, they would do the whole body, and all of a sudden they were becoming a shoulder guy or a knee guy. And I just couldn't stand it. I mean, I was like, my father was an orthopedist and did everything, and I just knew that I'd be unhappy. So I think, pardon my bias, but kind of the best and the brightest and the people that love to use their brain that are going into surgery choose plastic surgery because of that. And I do thousands of procedures. I mean, I could do any one tomorrow and do it extremely well. And it almost is a compounding effect. I think the more I do, and the different problems I see. And I don't even just do cosmetic surgery. I do reconstructive surgery. I learn something every day. And it's probably something that I kind of figured out or saw work well in this scenario, and I'll apply it to all of my other surgeries and cosmetic surgeries. And so I don't do my tummy tuck, some technique I was taught 20 years ago when I was learning. I've kind of melded a million different tricks into the way that I do it. And yeah, I just love the excitement of it, and applying those principles and making new ideas every day.
I love it. So for our listeners who might not know, what would be a reconstructive surgery, or why, for our listeners who don't know the
Yes.
difference between a cosmetic and reconstructive, what would be reconstructive?
So there's a million things. I mean, the most common is obvious. I mean, breast reconstruction, where we may be doing it somewhat similar to breast augmentation, where we're using an implant. But there's also techniques where we kind of do a tummy tuck, taking the tissue from the tummy, moving it to the breast. Very intricate procedures. But like I said, you're essentially doing an advanced version of a tummy tuck and a breast augmentation, having to do more complex things that then make your eyes open to ideas of a more simple operation. We deal with gunshots or trauma or cancer reconstruction. Somebody could have an open wound on their leg with an exposed knee joint, and we got to be able to move muscle over to cover it. I mean, a million different things. Skin cancer reconstruction, where we're moving the forehead down to cover the nose, or barring, sliding things around. How do you fix a 1-inch hole in somebody's lower eyelid by sliding their cheek over without pulling their eyelid down? And in order to do that, you have to know anatomy, geometry, and physics all blended together. But you also then usually have to do things like a canthoplasty, which is where we tighten the ligament in the lower lid so that there's no tension pulling down on the eye. And then when you have a patient you're doing a cosmetic lower lid on, the little bit of tightening they need is easy compared to that. And you really kind of learn how to hammer it down and do it great.
I love that. Part of one of the things that I really love about what I do and working with plastic surgeons is plastic surgeons are geniuses. Like some of the stuff that I've seen done where I'm like, how did you do that? And it's so complex, and I love it. I love plastic surgery. I love the solutions that it brings to people, and I'm happy to hear how you can tell us exactly how that mental gymnastics works when you're doing cosmetic procedures. As you know, there's a lot of cosmetic surgeons out there who say, I'm talking about just cosmetic surgeons, not board certified plastic surgeons, that say, oh, well, board certified plastic surgeons, they're reconstructive surgeons. They don't know anything about cosmetic because they're not doing cosmetic surgeries. They only do these requirements. So I feel like this right here is just an example of exactly. That's why we're so good.
Exactly. I mean, yeah, you're kind of lighting the flame under my fire right now. I mean, that couldn't disagree with that statement before. I've heard it firsthand from a cosmetic surgeon, and he also preached it to his staff, that they waste their time doing reconstruction, whereas I only focus on cosmetic surgery. I mean, that's insane. Like I said, to me, my cosmetic surgeries are, I mean, I love them and I put a lot of passion into them, but they're kind of the easier things that I do. And as I already mentioned, I've modified everything I do cosmetically from very important lessons I learned with a much more difficult case, and it's benefiting my patients tremendously. I mean, I feel like I could do just cosmetic surgery with a very small portion of my brain, whereas the reconstructive stuff, you really have to think long term, and it just makes everything better.
I love it. I love to hear it. So I always have this segment on my show, and we've been doing it since we launched. And I always like to ask my plastic surgeons if they are team drains or no drains when it comes to their abdominoplasties.
Gotcha. I'm definitely team drain. I've tried the no drain abdominoplasty, and basically the general concept for your listeners is, how could we eliminate or reduce the need for drains? And it's eliminating dead space. So if you do a tummy tuck, you're essentially lifting up about a 1 foot by 1 foot area of free floating skin on top of the muscle and the fascia. So we have a drain to help that stick down. And then, pretty smart concept, but people started trying to go to no drains by doing quilting sutures. So it's essentially like little plugs in each of that area to pull the skin and the fat tissue down to stick to the fascia. Great idea, and I use it all the time. Now, what I do is I still use a drain. So they're less likely to need the drain. The drain will be in for a smaller period of time, but I bet 7 out of my 10 patients, every 10 patients benefits from the drain and has a better result and a faster recovery because I put the drain in. If they didn't need much of one, it can come out in 2 or 3 days. I mean, there's no harm in doing that at all. The scar from the drain is essentially invisible most of the time. It is annoying to have a drain, but especially, like I said, if you really didn't need it, it's there for those first couple of days that are kind of unpleasant and a fog in your memory when you think back on it anyway. And certainly if we have to leave the drain longer than a couple of days, it needed to be there. So, I wish patients didn't have to deal with drains, but I promise you it's for the best.
It's for your own good. It helps you heal faster. It helps you heal better.
Seromas are no fun.
I know that you guys hate them, but I promise you, they're only there temporary and they'll be out of your hair before you know it. And I'm 100% team drains.
Yes. 100%. Seromas can be a persistent problem for weeks or months. And I'm sure we may touch on this later. People still like to travel for cosmetic surgery to various places that are either really, really marketing it or a little bit cheaper than maybe doing it some other places. But they just leave those towns where they had it done with fluid issues, and they are showing up in our ERs left and right. I mean, fluid that is in a pocket is very prone to infection. It's very prone to problems, and it doesn't just simply go away. So I try to avoid those.
You brought up such a good point, and I was going to save that for the end of our episode, but now, since we're already on it, there was something that you had on your form that I thought was really interesting, and I wanted you to tell my audience about it because women are finding plastic surgery or cosmetic surgery across the country, in other countries. And I feel like there's a large portion of them that feel like you just go, you get it done, you go back, and that's it, you're done. And that's definitely not the case. You need to have a very special relationship with your surgeon. And I noticed that was something that you brought up in your guest form, that patient relationship. So I'd love to talk about that.
Yeah, I mean, I'm very, very passionate about that. I mean, when I meet a patient during a consultation, I mean, I know they're deciding if they're going to use me, but I'm also deciding, are we going to have a good relationship? My expectation is to be very intimately involved with that patient for at least months, if not years, and if not forever. It is not a one and done. Yeah, sometimes things go absolutely perfect, and at 3 or 4 weeks, I'm like, well, you're really doing great. I usually see people a little more often, but we can probably go a few months and then check you back. But that's probably the most extreme example. I mean, some of my patients I see every week for 6 or 8 weeks. I mean, yes, it's a quick visit, checking on things. I can give them updated information about best way to manage their scar or whatever, depending upon what they look like. This is not a cookie cutter operation where everything's exactly the same at 1 week, 2 weeks, 4 weeks on different patients. And a lot of them need further education, hand-holding, discussing silly things. I mean, silly is the wrong word, but like constipation and things like that. You can't learn all this on the internet or from your buddy that had surgery. They may not have had the same issues. So it is definitely a pet peeve of mine when people get the concept of they can just go get their nose done in a foreign country and that there won't be any problems and just follow up back home. And then what happens is their internal medicine doctor doesn't know anything about it. And then if they get a problem, they end up in the emergency room, and it ends up being very expensive on the patient because insurance really doesn't cover complications of cosmetic surgery. But again, it's kind of the world we live in, right? So uh, there are places that are mass marketing these things, and uh, probably more than people like us that are a smaller clinic. And when I'm busy 99% of my time operating and and trying to run the practice, and also being a family member at home, and I'm not spending a ton of time marketing. And it can just fool you. I mean, that's our whole world, right? I mean, people are buying cheap versions of computers, and then 4 months later they're broken. But it's just all about marketing. So, uh, what I also I'm rambling a little bit, but my other opinion on these mass market clinics is my opinion only. Don't mean to offend anybody, but I think they're very aggressive with their treatments, so that, let's say they do 10 patients and they're very aggressive on all 10. One's going to have an amazing result and not have any problems. Three are going to have problems, and six are going to have either some trouble healing or not a great result. And they're doing that, and then they're going to market that 1 out of 10. They may do a lot more liposuction during a tummy tuck than I think is safe. My goal is for every patient to not regret their surgery. And I've had a lot of patients go to these other types of scenarios that are more mass volume that very much regretted ever having plastic surgery. And that is, I never want to hear that. It's certainly not from one of my patients. I wish I didn't hear it at all. Because again, I love plastic surgery. I've devoted my life to it. And for people to have bad experiences that are for unsafe reasons, I really don't like.
And I bet whenever you hear some things like stories from patients or somewhere you're hearing and you're thinking, they did what? How are they getting away with that? Or how who's letting this happen? Or why is this happening?
Yeah, I mean, what patients need to know, absolutely. And the reason is, it's scary to hear as a patient, but you can do almost anything you want in your own clinic if you have a medical license. Okay. Patients don't understand that at all. And it's hard to get that word out. I could do brain surgery in my clinic tomorrow if I wanted to. There's nobody to tell me you can't do that. I have a medical license, and I can. Now, if I try to do it at the hospital is going to say, show me how many you've done, show me your training, show me some results, show me infection rates, show me complication rates. Oh, I'm sorry, Dr. Park. That's not enough. We're not going to allow you to do that here in our hospital. But if you own your own clinic, you can do it. And that's very, very scary. And people are like, oh, well, can't they lose their license? It's pretty difficult to get through that process of having somebody lose their license, or they'll just change states or kind of disappear. I mean, I've tried to reach some surgeons at these mass volume clinics about a patient I'm taking care of in the hospital 2 weeks after their tummy tuck with a major infection. And I try to call their surgeon to give them an update. And they're like, oh, they're not here anymore. They just came for a week. They might be back next year. It's mind blowing to me that that's happening in our country. It used to happen in other countries in the 90s, but it's really happened in our own country since 2000. It's really kind of shocking.
It
And
is
this,
very shocking. And, on the show, I like to talk about the things that women don't know, our listeners don't know. They're one day deciding, hey, I think I want to have surgery, and they start researching online. And these practices that have a lot of volume have whole marketing teams and whole strategies to get in front of those women who are looking for surgery. And so to the women who are looking for surgery, it's like, hey, this place is great. They have great reviews, or they have fabulous pictures, and they have tons of followers online, and everything looks legit. But then going through the process, they start to see like, oh, they want me to very quickly put down a deposit on a date. And I haven't even met the surgeon, but
non-refundable deposits. Yeah.
non-refundable deposit. Um, they are pressuring you to book your surgery, and it's kind of this very forceful process of getting your deposit, getting your payment, and then once you're past that, it's good luck. We'll see you hopefully for your follow ups before you leave out of town, or before you go back home, and good luck getting a hold of us after that. Which, I mean, if you've gone through plastic surgery, you know, like, you have questions, you have a lot of doubt. That those first couple of weeks, you need a lot of hand holding. And I help women through this process all the time. And they've told me, how do women do this without any help, going through this process and not have somebody who's telling them like what to do and helping them through the process? And I'm like, that's why I started this show, because there wasn't really a process of what should you look out for. Surgeons, board certified plastic surgeons like yourself, you guys are busy. You're in practice, you're doing surgery, you're taking care of your patients, and you're trying to, you advocate in your practice, maybe advocate online, but outside of that, you have your hands full. And sometimes these places, they have their hands full with pressure and pressure and pressure, and give me your deposit and you get this $500 discount, and we'll throw in a garment, and we'll do this and we'll do that. And I've had conversations with women who tell me, I felt like I had to leave a deposit. I felt like I was like very pressured to hurry up and pick a date. So I always love to highlight surgeons like yourself who are not on that same boat and who are doing things how I feel is the right way. Building a relationship with the patient, establishing trust, establishing a bond with that patient, and following up with them, not just for that immediate post-op period, but for however long that patient needs.
Yeah, I mean, absolutely. I mean, my patients can't, any patient with breast implants, I tell them I want to see them once a year, and they always look at me shocked. Like, I'm not going to get mad at you if you don't show up, but I will identify problems that you can't. You see your breasts every day. If they're getting a little bit of capture contracture, which your listeners probably know what that is, but pretty rare, but it's what we worry about is the implants getting a little hard. You see them every day, you don't know, but I'll notice a difference. I mean, I'll have patients come in with rock hard breasts from the 1980s that think they're fine. They just have no idea. And I'm like, those have probably been ruptured since 1990. So it's time to get them out. So yes, 100% agree. It is a relationship, and you know, medicine and plastic surgery unfortunately has to be a business to succeed. But if that's the primary focus, it's just wrong. You know, we definitely don't do that. We're probably the opposite. We're probably to a fault where I consider a consultation your chance to learn and discover. And, you know, we're going to tell you pricing, and we're not going to call you every week and be like, you ready to schedule? You ready to schedule? Like, I mean, a lot of my patients, I've been in practice for 17 years, and some patients will show up 6 years after the first consult, and it's finally time. And we don't, they want the tummy tuck we talked about then, but they weren't sure if they were going to have another child, or they wanted to lose some weight, or they were going through a tough time in their marriage, or whatever. I mean, it is not something you should make a quick decision on. And you just need to have somebody you can trust and that needs to be there for you.
Absolutely. So before I let you go off this episode, one of the things that I want to touch on, that maybe our audience maybe they have an idea that this is happening, but they don't really understand what's happening behind the scenes. So online, if you look in the chat rooms, you'll see where people are talking about surgeons who are in solo practice and surgeons who are in group practices. And what has happened behind the scenes is that sometimes these practices are being purchased by private equity companies. And I have seen firsthand experience of changes in practices after they've been purchased. Some practices have been purchased and they don't change at all. They let them run exactly how they are. But on the other hand, there's other practices that are purchased and everything changes. Everything changes. So I'd love to touch on that a bit.
I mean, it's pretty simple to understand. I mean, so the term going around for people that don't know is PE, or private equity. And that just means private funding, purchasing a clinic with, this is where it's obvious. The goal of that is to maximize profit. It is to view it as a factory that's making toy cars. How can we do it a little cheaper? How can we charge a little more? How can we let more people know about it? So it's not per se the fault of the people that are in the PE firm. They're doing what they're supposed to do. But that is a bad influence on medicine, in my opinion. As a generalized statement, certain PE firms still let the physicians make the day-to-day decisions, or at least the big picture decisions. And I think those will continue to be the ones you're talking about that end up in the positive light. But other ones are taking control away from the physicians and doing their job of running a business. But this is not a business first. It has to be business in your practice to succeed. But it is a relationship and a physician-patient relationship more than anything. And if I'm all of a sudden told, oh, you can't see that person every week because it costs this much for your nurse to go in the room, and how often are you actually finding a problem? Like, come on, that I never want that. But that is the PE firm doing their job of making it more of an assembly line, which is the opposite of what a patient should want, is being a part of an assembly line.
Well, I've really appreciated you being on the show with me today, Dr. Park. And I want you to let my girls know where they can find you if they want to come see you for surgery. Okay.
Well, we're in Mobile, Alabama, which is down on the Gulf Coast. We are at the Park and Rebo Clinic for Plastic Surgery. We're at www.parkrebo.com. Our main number is 251-340-6600. And you can always email me at drpark@parkrebo.com, or just send an email to info@parkrebo.com.
There you guys have it. So if you are in the area and you're looking for some sort of procedure to make yourself more beautiful, go ahead and reach out to Dr. Park. And with that, you guys, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Your support helps more people get real, unbiased info they need. And if you're ready to take the next step in your surgery journey, I've got you covered. Book a consultation with me at bigbuttsnolies.com, and let's create a plan to get you the results you've been dreaming of. Follow me on Instagram at Big Butts No Lies Podcast, on TikTok, and on YouTube for exclusive behind the scenes and more real talk about plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.